if your mid-back is weak, if your rotator cuff is weak, if your posture is slouching forward, and then you start to get some neck pain and you ignore that, well, all of a sudden you start to get these MRI findings. You start to, oh, wow, I have degenerative disc disease. I have facet arthritis. I have stenosis. Where did this stuff come from? Must be my genetics. If you leave problems, if you leave dysfunction in the system, you end up destroying that system. You get rapid degeneration. And so you've been ignoring and overriding for 20 years, and you were just compensating and load shifting into that neck. And you do that for 10, 15, 20 years. You create structural issues in the neck. Welcome to the Joint Pain Podcast, where we have discussions on the science and art of joint pain and longevity. I'm your host, Matthew Lister, the founder of Align Pain Management. Today we are talking about how to fix neck pain. And welcome back, Jamie Daniel.
Thanks for having me.
Jamie is a senior joint pain coach at Align. She is here today to play the role of the simplifier. So I'm going to be laying out a framework for how to fix neck pain, and Jamie is going to be simplifying it along the way, asking questions, which is very natural in our in our relationship. And it's going to be great. I'm excited.
Yeah, thanks for having me.
Let's dive in. So we're going to use the same setup as we did before for how to fix low back pain. We're going to start with the simple takeaway. This is a 3 to 5 minute, very condensed explanation of all the content that you're going to get in the whole podcast, just with less explanation and a little simpler terminology.
Got it.
Awesome. The simple takeaway, 90% of neck pain cases are classified as non-specific neck pain, which means it isn't possible to identify a specific cause or reason for the pain.
That's wild.
That's a troubling statistic. Mm-hmm. It's the same for low back pain, which is interesting in and of itself. But what that leaves us with is hundreds of millions of people with pain and no clear answer as to why they're hurting. Next, research has shown that neck pain is in the top 3 joint pain areas in terms of complexity. And so it's low back pain, it's neck pain, and it's like headaches is like the top 3 in terms of complexity. And so neck pain is number 2. Low back pain is number 1, naturally. So what the research shows is that on average there are 15 to 30 individual variables and individual problems contributing to people's experience of pain. Highly complex, very difficult to figure out what is driving the majority or the minority of that pain experience.
Wow.
So we simplify joint pain with what we call the neck pain equation. And so the neck pain equation has 2 parts. The first part is joint problems. Mm-hmm. The second part is stress problems. And when you add those together, you get the cumulative experience of your pain. So we're going to break that down briefly. So the first part, joint problems. So that consists of mid-back and scapula dysfunctions, mid-back and scapula problems, and then structural issues in the neck. So those are the 2 pieces of the joint issues.
Okay.
The second part of that, stress problems, is comprised of inflammatory problems and nervous system problems. So when you add up mid-back and scapula instability, structural issues in the neck, inflammatory problems, and nervous system problems, you add all those problems up, you get the cumulative experience of pain that people are in.
It's a lot of problems.
It is a lot of problems. There is a way out, though. It is manageable, and we've really made a simple framework for people to understand and engage with their problem and try to give them language for their problems. And so we've come a long way in simplifying what is really a complex, opaque issue. We're going to go through the 6 questions to fixing your neck pain. So You need to be able to answer yes to all 6 of these questions in order to fix your neck pain. If you answer no to any of these questions, you are leaving problems in the system that are going to be drivers of pain. Make sense?
Yep, got it.
Okay. We're going to start with joint problems. Question 1, can you do wall angels? 3 sets of 20 without neck compensation. So if you can't do this, if you can't do wall angels, 3 sets of 20, without neck compensation, your neck is compensating for weaknesses and dysfunctions in the mid-back and in the shoulder blades. So the neck is just getting beaten up because of problems elsewhere in the chain.
Yep, that makes sense.
Question 2, can you do side-lying external rotations? 3 sets of 20 with a 3 to 5 pound dumbbell. If you can't do this, you don't have adequate strength through your rotator cuff, and again, your neck will compensate for the lack of strength and function in that rotator cuff. So again, it's just victimized by weaknesses elsewhere in the upper body system. Question 3, has a world-class surgeon confirmed I don't need surgery at this point in time? Depending upon the duration of your pain and the characteristics of your pain, this one should really be the last question you check off your list. Now, there's some caveats to that. Obviously, if you're having like nerve pain down your arm, or you were in a car accident, I mean, if there's any acute,
Sure.
like that's a totally different conversation. We're talking chronic pain.
Right.
But if there is a severe structural issue with the spine, there is no amount of biomechanical fixing, nutrition, inflammation treatments that are really going to help that. And so we aren't against all surgeries. We are against unnecessary and unpredictable surgeries.
Yes.
So you need to be able to check off, has a world-class surgeon, that's an important term, world-class surgeon confirmed I don't need surgery at this time. On to stress problems. So we're on question 4 of 6. Have I eliminated ultra-processed foods? It's a big one. So if you are consuming ultra-processed foods, you're going to be creating inflammatory stress in your body. You're going to be creating a systemic inflammatory response that will be a multiplier of your pain signals. Question 5. Am I doing 3 30-minute sessions of low-intensity aerobic training per week? If you aren't doing this, you are likely not moving your lymphatic fluid as effectively as you should be. And so you are leaving inflammatory cells, inflammatory mediators lingering in your joints. And so you're just sort of bathing your joints in an inflammatory soup. And
Got to get those out.
and that is not helpful. It's important. Question 6, last question. Do I have anxiety, depression, loneliness, and sleep well managed? If you don't have anxiety, depression, loneliness, and sleep well managed, those will all be major amplifiers of your pain signals or even root causes of your pain signals. And so taking care of your nervous system through a structured stress management protocol is really, really, really important. And if you don't have that box checked, you will likely remain in pain. And if you do have higher levels of anxiety, depression, loneliness, sleep disturbances, and then you simultaneously have structural issues, it's really unclear whether or not you should get surgery because you don't know how much of your pain is coming from the structural issue versus the central nervous system dysfunction with the symptoms of stress, anxiety, loneliness, sleep disturbances. And so it really just convolutes the problem and makes surgical outcomes really unpredictable.
That's fair. It muddies the water. It's a huge factor. And until that's managed, you don't really know what the structural issue is causing.
Yeah. That's the simple takeaway of the episode. So that is a highly condensed version. We're leaving out a lot of explanations, but if you're looking for more information, keep watching, go into the deep dive. But if you're wanting to understand how to fix neck pain and you're just needing that concise explanation of what is driving my pain, what do I need to be thinking about, that's the simple takeaway.
That was good. I mean, I've been to a lot of your classes, but that was good.
Let's go into the deep dive.
Okay.
So the deep dive is just unpacking these questions, unpacking the statistics, so we can really understand the science behind them. So let's start by defining the problem of neck pain. So neck pain is the second most common musculoskeletal condition behind low back pain.
Right.
And is the second leading cause of disability with 200 million people affected worldwide. It's a big one.
Oh my goodness. Yeah.
Specific neck pain, which is neck pain caused by a specific disease or structural issue, a known cause, makes up only 10% of neck pain cases, a fraction of the whole. Non-specific neck pain, which, as you know, is when there isn't a clear known structural cause for the pain, makes up 90% of neck pain cases, which means that hundreds of millions of people are in pain, and there's no answers for them. There's no grid for what is driving their pain. There's no language for it, and their doctors don't really have language for it, and so they're just left sort of wondering, what should I do? And their doctor will sort of throw treatments at them haphazardly. Well, we could try this. Well, we could try this. Well, if you're just trying something, you're just throwing stuff at the wall and seeing what sticks. So there's not a clear path, a clear framework for evaluation and treatment of these types of problems in standard Western medicine 2.0. Yeah. Any questions there?
I just think it's wild that it's the second leading cause. And I mean, back pain too, like that's hundreds of millions of people that are suffering and they can't work, or they work and they're just in pain every day. And it does, when you frame it like that, it's like, wow, we should really do something about that. And then you did. So good job.
We are.
I know, but it just, you hear about the problem and you're like, oh my gosh, like, wow, what are we doing to solve that? And then, so before I found Align, it was, work in the hospital, it was surgeries and pain pills and all of those things. And so I think now what I've learned from you, I'm like, oh, this does make sense. I just didn't know why before.
Yeah. It's one of the most challenging pieces to pain, chronic pain, is that there's no good language for it. And so in order to fix it, we have to upgrade our language. And we don't realize that we don't have good words for it because it's just feelings and it's emotion, and it's so in our gut and in our brainstem. And so we really have to pull it out and dissect it and use our frontal lobe and really begin to put better words to it.
Yeah, distinguish it and isolate it. And when you know what the problem is, then you can go about solving it.
Yeah.
Yeah.
Yep. Next, let's break down pain response strategies.
Okay, tell me about it.
So you experience joint pain. How should you respond? You have two bad options and one good option. Okay. I'm sure you've witnessed plenty of these. So let's start with the two bad responses. Bad meaning they don't produce good outcomes. So rest and lifestyle restriction. This is the worst possible strategy. I always start with it because it is so insidious and so diabolical and so intuitive. People you hurt, and so you want to rest, and it just makes total sense.
Yeah.
Unfortunately, it's just the absolute worst long-term strategy because you just back yourself into a corner and you just lose all the things that you love because you hurt, and so you rest and you get weaker and you get tighter, and then you try to go back to your activities and you hurt. And so then you rest and you get weaker and you get tighter. And then you go back and you do even less than you were doing. And you just backpedal yourself into a corner until you're in your 60s and you're in your 70s and you're like, I can't walk upstairs. I can't walk to the mailbox. I mean, people just get so shocked at how much limitation they have. And it was because of a pain response strategy that they had been employing through their 30s, 40s, and 50s.
It's devastating. A lot of times grandparents will say, I can't hold my grandkid. I'm scared. I can't hold them safely. I'm worried I'll drop them or fall. And so that's massive if you feel like you can't hold someone close to you that you love, and it's because your neck hurts too much.
Yeah.
It's devastating.
Yep. The second strategy is ignore and override.
That was me.
Everyone identifies with one of these. It's the second worst strategy, and it leads to just the destruction of your joints. And so you experience pain and you go, oh, well, I'll just keep going, rather than figuring out what is driving the pain, what the problem is. You just go, I'll just keep going. I'll just keep doing what I'm doing.
Yeah.
Ignore, override,
Power through.
mentally tough.
Yeah. I'm
There's
fine.
so many areas of life where that is an acceptable, good strategy. Joint pain is not one of them.
No.
It's really not, because if you leave problems, if you leave dysfunction in the system, you end up destroying that system. You get rapid degeneration. And so if your mid-back is weak, if your rotator cuff is weak, if your posture is slouching forward, and then you start to get some neck pain and you ignore that, well, all of a sudden you start to get these MRI findings. You start to, oh, wow, I have degenerative disc disease. I have facet arthritis. I have stenosis. Where did this stuff come from? Must be my genetics. Well, you've been ignoring and overriding for 20 years, and you were just compensating and load shifting into that neck. And you do that for 10, 15, 20 years. You create structural issues in the neck.
It's true.
That's the outcome.
Easy to do, though.
Yeah. Let's talk about the one good response. Explore and correct. So we have to understand what pain signals are. Pain signals are a signal from the brain, an interpretation from the brain that there is a problem. That's it. It's a fire alarm telling you that there is a fire somewhere. And so the explore and correct response means that you hear the pain signal, you hear the fire alarm, and you go, oh, there's a fire somewhere. I need to get my fire extinguisher and go find this fire and put it out. I need to find the biomechanical problem or the inflammatory or the stress problem that is creating these pain signals, and I need to fix it. That's the explore and correct response strategy, and it's the only one that leads to good long-term outcomes. That's why we call it the one good option.
Because you're finding out what's going on, and then you can actually solve it.
Yeah. Next, let's talk about complexity. So neck pain is in the top 3. It's number 2 of the joint pain areas in terms of drivers, in terms of complexity of causes. And so, again, on average, you'll get 15 to 30 individual problems that add up to create people's neck pain experience. And those can be ultra-processed foods, not getting enough movement, so you're not moving lymphatic fluid. That could be not getting enough sleep. That could be having too much caffeine. That could be stress. That could be unstable shoulder blades, weakness through the rotator cuff. So, I mean, we're up to 7, 8.
Breathing patterns.
I mean, and you eval people all day long.
I do.
8 problems is an easy case.
I think I had that one today. Actually, it was probably more, 15.
I mean, really, it's not uncommon to pick apart someone's case and have 20, 25, 30 problems. And that can be super overwhelming for people. But I always tell them there's so much hope in that, because we have identified 20 or 25 easily fixable problems, and each of them are contributing 10 to 20% of your pain. And so we fix one of these 20 problems, easily fixable problems, and we can reduce your pain by 10 or 20%. If that's not a message of hope, I don't know what is. Because when you frame it that way, people are like, oh, I can drink more water to get out of pain?
Yeah.
Easy. I'll drink 60 ounces of water. Oh, if I cut my caffeine down to a healthy range of 200 milligrams, 2 cups of coffee, I can reduce my pain by 10%. Done. Oh, if I lay down and pull my shoulder blades back, I can reduce my pain by 10 or 20%. Done. And so I think there is, while that message of complexity, I think, can be overwhelming, I see it and I teach it there's so much hope in that, because there's identification of tangible problems with easy solutions behind them.
Yeah, because you've gone from non-specific and unknown, that dark, cloudy room, to you have multiple specific things, but we know how to solve them.
Yeah, and when you have that vague, undefined pain in your life, you have fear and you have anxiety and you have confusion and hopelessness, and those things just amplify. They just multiply pain. One of my favorite stories of this was I had a gal come in for a consult, and her pain levels were averaging 7 to 8. So she was in a ton of pain. I mean, she was like bracing, and she was in a ton of pain. And we did the consult, broke it all down for her, laid it all out. And when she came back in for her first day, her new client evaluation, she said, "You're not going to believe it. My pain is already down by 50%. I've been averaging 4s." and she's like, what is that?
It's called hope.
There is a very powerful medicine called hope. and she said that she just wasn't afraid because she had hope, and she knew that there was a way out of pain, and she just relaxed, and she let go of that tension, and she let go of that fear. And it was such a fun encounter. You're like, that's why we're here.
Yeah.
That's why we're here.
Oh, I love that.
Okay, let's simplify the complexity of neck pain with a simple equation, the neck pain equation.
Okay.
Joint problems plus stress problems equals your pain. So you just add them all up, squish them together, and that's the mountain that is your pain. So let's break that down. The first part is joint problems. So mid-back and scapula instability. So when the mid-back and your shoulder blades aren't working properly, that just shifts load up into the neck, and the neck compensate and gets abused by that. Next is structural issues. So any structural issues can contribute to your pain, and so you're just adding that up. The second part of that is stress problems. So you have inflammation problems, anything in your lifestyle that's driving up inflammation, and then nervous system problems, sleep, stress, anxiety, depression, loneliness, sleep disturbances, PTSD. All of those are going to really drive up pain signals. So when you add up mid-back and scapula instability, structural issues, inflammatory drivers, and nervous system problems, you get your pain. You get all the drivers of your pain. And again, that's a lot of variables, and that can be confusing. But the one of the biggest hurdles to actually solving these problems is actually pulling them apart and putting words to them, because once you put words to it and identify it, you can tame it, you can battle it, and you can conquer it. And when it's the dragon in the darkness of the cave, there's just fear, and you can't battle it until it's out in the light. And so getting it out and picking it apart and giving words to it it's so fundamental, and it is the absolute first step. You cannot get out of pain until you do that.
Yeah, you don't know what weapon to use if you don't know what you're fighting.
Totally. Okay, let's dive into the 6 questions to fixing your neck pain.
And you've got to say yes to them all.
And you have to say yes to them all.
Okay, got
Yes.
it.
So we're going to unpack the science behind the questions. We'll start with part 1, joint problems. So mid-back and scapula instability is the first part of this. And so when it comes to joint problems, mid-back and when it comes to neck pain, mid-back and scapula instability is the first thing we have to talk about. But I want to start with an analogy. Your neck is like the roof, and it is resting upon the pillars and the foundation of the structures below it. And so sometimes what happens is the foundation falters and the frame starts to sag, and you get problems below the roof, and the roof fails. And it's not the roof's fault. The roof was just resting upon everything below it. So in the same way, the neck rests upon the mid-back, and it rests upon your shoulder blades and its function. And so you cannot have a stable, sound neck without having stable mid-back and shoulder blades.
So if what the neck is relying on isn't working, the neck will start to have pain.
Yep.
Okay.
Yep. So the principle is you don't get pain in the area of the body that isn't working. You get pain in the area of the body that is compensating for other areas of the body that aren't working. So you get neck pain because your mid-back and your scapula aren't working well, not because your neck isn't working well.
Illuminating.
Love it. The neck, so people often report chronic tightness through their neck, chronic trap tightness. And this is a principle that can be applied across the body. Wherever you have chronic tightness, somewhere else there is chronic weakness. And so everyone always wants to massage and trigger point and just beat up the muscle that's chronically tight, but it's holding on for a reason, and it is contracting for a reason. And so you cannot get something that is bracing your structure, that is holding your structure together, to loosen. You have to identify what the chronically weak muscle is, so that way you can strengthen it, and then the chronically tight muscle can relax naturally.
I tell my clients it's like when you're short-staffed, it's not the staff's that their fault. It's not their fault. It's the staff that didn't show up. So you have to identify, oh, the staff didn't show up, and now we don't have enough to work with. So it's not the neck and trap's fault. It's what wasn't showing up that now we're having the problem.
Yep, 100%. Okay, let's dive in. Can I do wall angels? Question 1. So the standard for stability is wall angels, 3 sets of 20 without neck compensation. That's a big one. And so we're going to unpack what this looks like. When you're doing your wall angel, your shoulders should not rise up toward your ears. You shouldn't be getting a lot of trap neck contraction. It should be remaining soft and supple. Your shoulder blades should be staying down as you're working your arms up that wall. Why does it matter? So there are 4 major areas of weakness in the upper body that lead to neck compensation, load being shifted into the neck. And Wall Angels addresses 3 out of 4 of them. So it's a big, impactful movement that if you can get down, you can cover 75% of the instability drivers of neck pain. So really important one. So the 3 out of 4, number 1 is thoracic extensors. So when your thoracic extensors are weak, you end up in that slouched posture position. Yeah, you can't stand up straight. And so when you're slouched, you shift that head forward. You have to crane your neck up in order to look up at society. Your head is forward, and so you're placing just massive amounts of load and stress and strain through these neck muscles that just shouldn't be there. The neck muscles should be balancers, stabilizers, and they should remain relaxed. And so if your neck doesn't stay relaxed on a very regular basis. I mean, 99% of your life, your neck should just be relaxed. That is not the case for most people. And a lot of that is just that thoracic extensor weakness. So number 2 is rhomboid weakness. So your rhomboids are what pulls your shoulder blades together behind you. It's what pulls your shoulder blades back. And so when your rhomboids, the muscles between your shoulder blades, get weak, the shoulders sag forward, and then your neck just gets put in this constantly contracted position, and our posture gets unstable. Every arm movement we make starts to jump up into the neck, and you start to get contraction in the neck when you shouldn't have been getting contraction in the trapezius neck muscles in the first place with that movement. So it just puts a lot of additional strain and stress on those neck muscles. And then number 3 is serratus anterior weakness. So your serratus anterior attaches to your rib cage, and then it wraps up to the inside of your shoulder blade and attaches to your shoulder blade. Luckily, we have an image up on the screen because this one's kind of a hard one to understand. But what it does is it takes our shoulder blades from sitting forward, and it actually pulls them upright. And so it gets you out of that tilted shoulder blade position and gets you in an upright shoulder blade position. And the reason that that is so important is that your serratus anterior muscles are the direct antagonist, the direct opposite to your trap muscles, your neck muscles. And so every bit of weakness in your serratus anterior muscles leads to increased contraction in your neck muscles. And so a lot of times people will say, well, why is my neck always tight? And it's just like dimmer switches. If your neck is contracting too much, that means your serratus anterior is not contracting enough. The way to fix that is to even those two things out.
This chronic tightness indicates chronic weakness.
Yep. So if there's chronic tightness in the trap muscles, then that means you have chronic weakness down in the serratus anterior muscle. And the wall angels are what will engage and strengthen that serratus anterior muscle. Super important. So how to get there? Because you will not likely on day one just jump up to a wall and start rocking some really well executed wall angels. It's a surprisingly difficult movement, and most people have a lot of muscle imbalances that keeps them from executing them well. And so you first need to loosen your pecs, and the way that we do that in the clinic, as you well know, is we have people doing weighted Ys, and so like pec stretches. We prefer weighted stretches. So you can do weighted Ys. You can also start by doing the angels on the floor. We call those floor angels. And the reason that it's such a big difference between floor angels and wall angels is because when you're on the floor, gravity is your ally. And when you're up on the wall, gravity is your enemy. And so floor angels are substantially easier, and that's really where everybody should start. And so lying on the floor, you're just going to glide your hands along the floor, and the key is really trying to get your arms all the way overhead with straight elbows while keeping your shoulder blades down out of your ears. These movements are all about scapula control, shoulder blade control. So if you're mindlessly doing it and your shoulder blades are just up in your ears, you are deriving no benefit from the movement. It's all about learning how to move your arm overhead while controlling your shoulder blades, because that is where you're actually learning to fire your thoracic extensors, your rhomboids, and that serratus anterior muscle.
Makes sense.
Great.
No snow needed.
No snow needed. Would make it more fun, though.
I know.
Question 2, can I do side-lying external rotations? So the standard for stability here is 3 sets of 20 with a 3 to 5 pound dumbbell with no neck compensation. Yep. So your trap muscles, your neck muscles should not be firing while you're going into this movement. And The reason it matters is because the rotator cuff is that fourth critical muscle that has an important job to do in the upper body. And when it stops doing its job, the neck catches that stress and that load. And so it compensates when the rotator cuff gets weak. So it's really important to have a strong rotator cuff.
How do people know if their neck is firing?
Yeah. If your shoulder is elevating up toward your ear while you're doing it, and so a good check-in is you just try to push that shoulder blade down, and if it's already down, wonderful, you were good. You can also palpate. You can just touch your neck muscles, and if they're rock hard, they're probably contracting. Or is it burning? Is your neck burning while you're doing it? And so do you feel it in your neck?
Means you're using it.
Yeah. If you're feeling it in the back side of the shoulder, it means you're using your rotator cuff. If you're primarily burning in the neck, that means you're using your neck muscles.
Okay.
So how to fix? This one is a lot of times pretty simple. You can just lay down and start doing the movement. One mistake that people regularly make is they overestimate how big of a weight they should be doing on this exercise. So they think, oh,
classic.
Well, this 3-pound dumbbell is tiny. There's no way that this could be hard. And then they're using their neck, they're using their deltoid, they're using all the wrong muscles. They can't keep their elbow down to their side while they're doing it. They can't get up very high, and it just, the whole movement falls apart. And so what I recommend is start with no weight. Just do body weight, learn how to actually fire the muscle, and then once you get good activation of that rotator cuff, go to a 1 pound. Once you can do 3 sets of 20, go to a 2 pound or a 3 pound, but cut the reps down to 10. Build up strength over a week and then go to 3. Build up strength over a week, go to 5. And so you want to get yourself there over a period of 4 to 6 weeks.
So our long-term goal is to get to the 5 pounds, but if you start at the 5 pounds too early, you're just reinforcing and building the compensating patterns, and so you're just creating more tension. So people have to pull back, activate the right pathways, get the right muscle doing the right job, and then build their way up to that 5 pound.
Absolutely. Because this really is neuromuscular retraining. We're retraining the brain's firing pathways and which pathway it's utilizing to execute the movement. So we're trying to retrain the way the brain is activating muscle sets. So if you go really heavy, like you said, you just end up using the strong pathway. So you have to back down, go light, and retrain that weaker pathway with consistency. When you're retraining atrophied neuromuscular pathways, it takes a lot of volume. Like daily is optimal, but really minimum 3 to 4 days a week if you're working on this stuff.
Because you have an atrophied muscle, and you have to give a request that's small enough that the atrophied muscle can actually pull it off. Because if you make a big request, the whole team's going to come together and try to help, but it's a solo act that you're trying to pull off. And so you got to make it small enough for the guy to actually get there.
Yep, and then frequent enough that you actually get adaptation.
Make change, yeah.
Yep. Wonderful. Okay, let's jump to structural issues. So when it comes to joint problems, the next thing we're going to tackle is structural issues.
Okay.
Question 3, has a world-class surgeon confirmed I don't need surgery at this point in time? So we aren't against surgery. We are against surgeries that are unnecessary and that are unpredictable in terms of their outcomes. So what we do is we teach 4 best practices when it comes to navigating structural issues. Best practice number 1, be informed. That's a big one. So if you want to be better informed on structural issues and when you do and don't need surgery, we recommend in our clinic to read David Hanscom's book, Do You Really Need Spine Surgery? It is a wonderful book.
Solid read.
Yeah. And I think he does a wonderful job of making it simple. I think he really puts it into language that people can understand. And so I think they did a wonderful job with the book. It really helps people understand what's driving their pain and when they should or shouldn't get surgery, because there's going to be an unpredictable outcome because of that surgery.
Because surgery is a massive decision. It's like trying to rebuild or renovate your home. And so if you're going to renovate your whole kitchen, you should really plan and think about it. You're going to be moving things around. And so you don't want to just one day go, I'm going to start ripping things up. You have to have a plan going in. And you'd like a knowable outcome, too, of what your kitchen's going to look like when you're done.
Yeah. So best practice number 2 is go to a world-class surgeon and trust their advice on structural matters.
What do you mean structural matters?
Structural issues. So degenerative conditions, stenosis, spondylolisthesis, degenerative disc disease, the things you find on MRIs, CT scans, x-rays. So let's unpack that sentence. Go to a world-class surgeon. So you really want to go somewhere where they are staying up to date on the latest research. You want to go to a place where they specialize in your type of problem. And so when you go to small town surgeons or non-world class surgeons, what you'll get is if they recommend a surgery, you say, how often do you do this? Like, how many of these do you do a year? And the small town surgeons will say, oh, well, I do 10 to 20 of these a year. And you're like, okay. And then you go to the world-class surgeon who specializes in only the thing you're getting done, and they will have done 50 to 100 that month.
Wild.
And the world-class surgeons in world-class clinics, they track outcomes. And so they don't just do a follow-up 6 weeks out and say, yeah, it looks good, okay, and then never talk to you again. They don't know if they actually got a good outcome from their surgery if they're not following up with you at the 3, 6, 12, 24-month mark. I mean, really, world-class surgeons are checking up at the 1 year, 2 year, 3 year mark. And so if you ask your surgeon, what does the follow-up process look like? And they say, oh, well, we do a follow-up evaluation at 4 weeks. You're likely not dealing with the best. Okay, so get to someone who is working in a clinic where they have a good system for outcomes tracking. And then trust them. These are complex matters, and some surgeries have really high and really predictable outcomes, really good and predictable outcomes. And so you shouldn't be worried about them at all. Other surgeries, you're just flipping a coin because there's so many variables in the mix, and we can and probably will do a podcast on that topic, but you at some point really need to trust the person who is leading you. And so that's why our best practice is go to a world-class surgeon and then trust their advice. And a second opinion never hurts.
I was thinking that. I was like, because sometimes you get one opinion, and to have multiple experts agree on something is very helpful, because when you have one person that you maybe don't know, from Adam, and when you have more than one expert agreeing, hey, this is actually the issue, this is what's going on, oh, we've cleared out some of the other issues, this is our understanding. We do it a lot, and we see these outcomes. And you want long-term outcomes, so you want someone who's paying attention to the long-term results of their surgeries. And that was David Hanscom. He had been looking at his own outcomes and then started doing more research, because he was like, why are these outcomes not as good as I want them to be?
Yeah, I think it's a powerful model for surgeons to take. And necessary
for us all to take, right?
Foundational,
tracking our habits, Matthew.
Totally, yeah. I am pro habit tracking. Okay, so best practice number 3: assess your stress.
Ooh.
So symptoms include anxiety, depression, loneliness, and sleep disturbances. If you are stressed, you just have to understand that that's going to add a level of complexity and a level of unpredictability to your surgical outcomes. And a good surgeon is going to recognize that, and they're going to be far more hesitant to do surgery on you because they don't know what they don't know what the outcome is going to be. They don't know if the structural issue that they see on the MRI is driving the pain that you're experiencing, and they don't know how your nervous system is going to respond to being cut into.
Yeah, because the stress, the depression, the anxiety, all of those are amplifiers. And so if you already have a nervous system that's very overwhelmed, and then you do a very overwhelming, traumatic, intense thing like surgery, then you're adding something to a system that has been pretty taxed. And so it gives an unpredictability that they can't control. It's your system.
Yeah.
Yeah.
And best practice number 4 is do your prehab and rehab.
Hey.
And fix all the joint instability problems that likely caused the structural issues in the first place. So if you want to get a really good surgical outcome, do as much of the prehab, the joint stability work before surgery that you can, and then do your acute physical therapy, and then go back and finish fixing the joint instability and strength issues that have been left in the system and that likely were the original cause of the structural issue in the first place. And so if you get a surgery but leave unstable joints, you're just going to be racing toward the next surgery. And repeat surgeries do not get better outcomes. And so if you have to get a second surgery, a third surgery, a fourth surgery, outcomes keep getting worse and worse and worse. And so by this is a low back statistic, but I'm sure it's applicable to the neck. By the fourth back surgery, the likelihood of a good outcome is 5%.
Oh my gosh.
That is not good.
How many did you have? 2, 3?
And they offered a fourth. And I knew that statistic.
5%?
I'm like, 5%?
No, thank you.
This is not where my life is headed.
Oh, jeez.
So yeah, it's fix the rest of the problems that are stacking up against you. It's like, yes, you may have a structural issue that is driving pain levels up. Fair enough. We will never deny that. But there are other things in the system driving and multiplying pain signals, and that were the original cause of the structural issue. So do your prehab, do your rehab. Ultimately, we need joint system. We need a body that is strong and calm. And so if we need a surgery in order to get to strong, great. But we need to be strong and calm at the end of this health journey.
That makes sense. I remember when I was working in the hospital, you could have a patient in A bed and a patient in B bed, same age, same knee surgery, and one person did all of their work ahead of time and the other person didn't. And the outcomes were night and day. Mm-hmm. This person's hopping out of bed, their pain's not too bad, it's managed, and then this person is just like, it's wrecking them, and they're in so much pain and they don't understand what's happening. And it's like, well, the muscles around the situation have a lot to say in your pain levels. And so just doing a surgery isn't like removing the whole problem. It's just taking care of what was left over, but your whole system was creating that problem and everything around it is still there. So you need to fix that.
Yeah. Well said. Okay, let's dive into part 2 of the equation, which is stress problems.
I don't have any stress problems, Matthew.
None of us do, right?
That's fine.
The American culture just really keeps us calm. So when it comes to stress problems, the first thing we need to tackle is inflammation. Question 4. Have I eliminated ultra-processed foods? So ultra-processed foods cause inflammatory stresses. They cause inflammatory cells to be present in our body and in our joints. So let's define what an ultra-processed food is. Mm-hmm. An ultra-processed food is something that can't be made in your kitchen. it has to be made in a lab or a commercial manufacturing plant. That just means that there are additives, there are processing that alters the food in a substantial way that our bodies negatively react to. And so, what does eliminating ultra-processed foods look like? Well, you can eliminate grains, dairy, alcohol, and anything that requires a lab or commercial kitchen to prepare. So eat a wide variety of minimally processed foods. If you've done all of that and you still have a persistent inflammatory problem, work with a professional to correct. You can have eliminated the ultra-processed foods, but if you have gut issues, then you can still have this rampant inflammatory process that is happening. And so eliminating ultra-processed foods is the first step. But then once you've done that, and if you're still having sort of pain all over, swelling, stiffness, then work with a professional to really eliminate any remaining inflammatory problems.
Yeah, and I don't want to blow over how incredibly challenging this is, but incredibly effective. Like, there are certain foods that you don't think it's a big deal, but then you eat it, and your whole body is having this danger or inflammation response to it. And so figuring that out, sometimes people can do it on their own. Sometimes you need a lot of assistance because it's an emotional experience, it's habits, it's lifestyles, it's the people you eat with, the places you go to eat. It's all of these things that you're used to. And the more that you can eat in a healthy, life-giving way, your body really thrives. But it can be such a massive change. And so it's a big deal.
Yeah, it is.
Yeah.
Well worth the undertaking.
Absolutely.
Okay, question 5. Am I doing 3 30-minute sessions of low-intensity aerobic training per week? So this is zone 2. This means you are doing aerobic training at a low intensity where you can still carry a conversation. You aren't huffing and puffing. You aren't out of breath. This is like a brisk walk. For more aerobically fit people, it might be a light jog, walking on a treadmill at a slight incline. That's what we're talking about. So low-intensity aerobic exercise reduces inflammation through improved circulation of lymphatic fluids and blood as well, but the lymphatic system is sort of the focus of this. That movement, that repetitive movement, pumps lymphatic fluid because our lymphatic fluid does not have it is mechanically moved. And so without movement, we cannot move lymphatic fluid. And our lymphatic fluid is like the waste removal system of the body. And so it is the system that is going in, gathering up the inflammation and pulling it out and removing it out of your joints. And so if you aren't moving lymphatic fluid mechanically with movement, then you aren't moving those inflammatory cells out of your joints. And then you're left with, as I said earlier, an inflammatory soup that you are bathing your joints in. That's gross. My image for that one of today.
I mean, it's effective.
And so it's really important to reduce local inflammation and systemic inflammation, but it also has additional benefits for the nervous system as well. It reduces stress, it reduces anxiety, it improves sleep. It improves metabolic health, it improves blood sugar, and so it decreases body fat, it decreases BMI, and so there's all these benefits to doing this low intensity aerobic training. And a lot of times when you're in pain, it can be daunting to do cardio or aerobic training because you're like, my body hurts. I can't imagine getting out for a run. Like it's just not going to happen, right? Yeah. And so, honestly, the recumbent bike is usually the best first option for people. That's usually where we will start people in clinic, is on a recumbent bike. It is the simplest biomechanical form of aerobic exercise. The next thing we need to tackle regarding stress problems is the nervous system. So question 6, do I have anxiety, depression, loneliness, and sleep well managed? Stress. So a lot of people think of anxiety, depression, sleep problems as the problem, but a lot of times they are the symptom of a different problem. And so when we see and when we hear stress, anxiety, depression, loneliness, sleep disturbances, we really need to go, okay, we see the symptom. What is driving that symptom? What do we need to do? What do we need to fix? Because that is those symptoms are almost like the fire alarm of the nervous system in another way. And so we need to see that and go, okay, what is my body trying to tell me? Why isn't my body allowing me to get into my rest and digest nervous system? Why isn't it allowing me to be calm in the midst of this environment? And the other thing to think about with stress is that it can be both a root cause or a multiplier for pain problems. And so you can have, and the research is clear on this, you can have stress problems as a root cause of joint pain. And so some of the interesting research is people with PTSD or people who have been victims of sexual assault, the rate of their chronic pain is extraordinarily high. It's like above 90%. Oh my gosh. And it's completely detached from any joint dysfunction. It's detached from any joint problems. These are central nervous system and peripheral nervous system responses, stress responses that are a root cause of pain. Now, in a less aggressive sense, mild to moderate levels of stress act as a multiplier of pain. And so you may have, like the story of the gal I talked about earlier who came in at a 7, and once her stress came down and her fear came down, she operated at a 4. That was before we fixed any joint problems. So she was getting a 3-point multiplier in her pain because of the fear and the anxiety and the stress associated with her pain. And so I think a lot of people have a hard time coming to the realization or grasping that their stress has anything to do with their pain whatsoever. And that can be a difficult one to get the realization, to get the light bulb to click on. But once it does, it's so powerful because then people can begin to choose into, I'm not going to stress about this because I don't want it to increase my pain levels. It's not worth it. And I mean, that's a little bit simplistic. You can't always just choose to not stress, right? And I'm not saying that. But you can begin to have words to navigate stress in a new and better way. When you begin to realize that every bit of stress you carry, you're going to multiply your pain levels. You're going to increase your pain levels. That's really powerful.
My friend and I were talking the other day, and she was like, oh, having stress or being dysregulated, it's so normalized. We have this super intense level, but everyone's there. So we're like, oh, it's normal. But it isn't normal to your body. And she was saying, it shouldn't be called that. It should be called like electrocuted or something. You're like, oh, I'm just a little electrocuted. And so that we would have this understanding, this awareness of this intense hormonal cascade or this intense place that our body is in. You're like, oh, well, I mean, I'm pretty electrocuted, but I think it'll be fine. And we were just saying like the word like isn't even helpful. Like we need a different word to understand what we're doing to our bodies and what they're under. And you're like, well, I had a friend, she had a big stressful thing happened, and then she's like, I'm just so tired. I'm like, you kind of emotionally ran a marathon. Like you need to recover, you need to sleep. If you ran a marathon and then you're like, oh, I should just go do a 40-hour work week, you're like, no, we don't. And so we definitely we underestimate what it's doing to us, and that's actually then we're not addressing it because we think it's not a big deal.
Yep. So In clinic, we use calm tools, what we call calm tools, that we recommend to treat anxiety, depression, loneliness, and sleep disturbance symptoms. So we'll just go through some of those. It'll also be in the show notes. The Balance app. So this is a meditation app with a whole series of guided meditation plans. Everything from easing loneliness to sleep meditation to gratitude to pain processing. There's all sorts of wonderful plans on the Balance app. And this is a non-sponsored plug to the Balance app.
Right, we just use it.
Yeah, if they want to pay us for this, that's fine. I would take it.
Contact us.
Contact us at. The second thing that we recommend is a book from a clinic out of, I believe, Los Angeles. I could be wrong on that. Don't quote me on it. It's called Self-Guided Pain Reprocessing Therapy.
Isn't that one you just want to pick up off the shelf?
Yeah. So that's the therapy called. That's what the therapy is called. But the book is called what? No Way Out? Sorry. The Way Out.
The Way Out.
The Way Out.
Yes, The
Very
Way
different.
Out. Yeah. Oh, then you might need a therapy after that.
Message of hope.
No Way Out.
The Way Out.
The Way Out.
And so essentially what this therapy does is it's rooted in neuroscience, but it retrains the way that your brain is firing. And so it turns off the areas of the brain that are responsible for processing and interpreting pain signals, and it turns on other areas of the brain that inhibit pain signals. And so it's really altering the firing patterns of your brain in a very specific way through self-guided exercises. It's very powerful. Highly recommend.
You mean people can do something about their stress levels?
Yes. Calm tool number 3, professional counseling to equip, process, and reframe life experiences. So sometimes what counselors do for us is they just give us a new tool in our mental tool belt to handle the complexity of life. It doesn't mean that we are broken. It doesn't mean that there is something wrong with us. It just means that we need a new tool. It's like going to the hardware store. I'm talking to the guys now.
Yeah. I was in the hard store last week.
It's like just going to the hardware store because we need a new tool to get the job done well. And so going to a counselor just is going to get a new tool for a complex challenge that you're facing in life.
When you have the right tool, it makes a big difference.
It does. Calm tool number 4, blood work. If you have big micronutrient imbalances, B vitamins, iron, just any number of things. If you have micronutrient imbalances, that can be a root cause of major stress, anxiety, depression, sleep disturbances, all sorts of stuff. Functional nutritionist. So getting with a professional to help you identify gut issues and any drivers of inflammation.
Hormonal imbalances.
Yep. Consume less than 300 milligrams of caffeine per day. So a cup of coffee is 100 milligrams, less than 3 cups.
Okay.
Drink 60 ounces of water per day. Eliminate ultra-processed foods. And do that 3 30-minute sessions of Zone 2 aerobic training per week. Those are the calm tools that we use in our clinic.
And they work.
And they do work. Okay, so recapping the questions. In order to get out of pain, you need to be able to answer yes to all 6 questions.
Yep.
Okay, so if you answered no to the joint questions, then you are likely unstable. You have unstable joints. If you answered no to the stress questions, then you are likely stressed. You have inflammatory or nervous system stressors amplifying your pain. To get out of pain, you need to be strong and calm. You need to be able to answer yes to all 6 of those questions.